Nayokya Partridge, who is our admin support supervisor. She oversees our contract with RICO, so she helps run the Image Center, which is the heart of our business. We like to say that we're paperless, but unfortunately we're not. And so Nayokya works with the team from RICO to make sure that we're getting our documents in the right place and into our claims administration systems. We have Mr. Lee McDaniel, customer service rep. Lee works with a lot of the different programs, so he focuses a ton of his time on the workers' comp program. Kim is able to accomplish her job through a lot of the work that Lee assists with. We have Nidra Westmoreland. Nidra is our administrative assistant who has touched just about every program. She reaches into property and liability on a pretty routine basis. We also have a property claims adjuster, Miss Rashida Harris. Rashida helps Ann in handling all the property claims, and hopefully if things are calm and quiet and Mother Nature doesn't get too angry with us, that's a pretty routine process, but we're grateful to have Rashida. And then we get into the folks that travel the state and spend time with you and helping you assess your losses and do the things that hopefully will make your place safer. We're going to talk a little bit about some growth in our program, both from the standpoint of premiums and appropriations, but this is probably one of the more exciting ones. We've been able to talk to our partners at OPB and expand our offerings under the loss control program, including our staff. So we're going to get into that. I'm going to start with our loss control safety officer, Mr. C.G. Lawrence. Going to go to Mr. Hiram Lagroon. We also have Mr. Todd Crisp. We have Miss Vicki Medlock. And our latest hire, in addition to our loss control safety officer positions, is Mr. Shane Barrow. So we're blessed to have these 5 folks and the dedication they have to burning up the road on my behalf to get out and work with you guys. So if you don't know who your loss control rep is, reach out to us. We can make sure that you get that contact. Make sure you reach out and welcome all of these folks to your team. And then again, the glue that stands behind these folks are called our operations analysts for the CLCP program. Miss Inyota Reed. And again, we've been blessed to be able to add a position, and we've added Shannon Majid. So some of you may know some of these folks. We were fortunate to grab a few of these people from the Department of Transportation. We've been excited about their addition to the staff, and also Shane came over from the Forestry Commission. So these folks bring a ton of history in the state agency level, but also the loss control and risk management level. So they're a wonderful resource, and they can assist you as we go through the online assessments and some of the stuff that these folks are going to speak to over the next few slides. We also have an amazing IT department. DOAS has probably one of the best IT programs in all state agencies, but we're fortunate to have some folks that are specific to risk. Derek Wade is our IT analyst who's been with the state forever and a moon. Mr. Tim White is our analyst who's been with not only risk management, but has had a stint with the fleet programs. Dan Osmond, a retiree who we were fortunate enough to convince to come back and play with us in this space. So you probably know Dan. And then we have an analyst, Rajiv Azad, who is also in our information systems program that is also an analyst. And then the last name on the screen is a contractor that we consider family. Her name is Faith Goodman. Faith has been working with Dan and Tim and Derek for a long time. She also is one of those folks that sort of kind of retired, and we were able to say, hey, can you come back and play with us? So these folks are the people that help you get into the claim systems, such as the Ventive IVOS product and the Ventive IRM, Integrated Risk Management Platform, to allow you to either run a loss report for your own utilization, to look at a particular claim. We can assist you in looking at those claims. It also gives you the access into the online loss control assessment through those tools. So any of these 5 can help you in those processes. Moving right along, I'm going to talk pretty quickly about the boxes you see on this screen. There are a ton of things that we can assist you with doing. These are the things that make us who we are. We are your Geico, we're your State Farm, we're your Allstate, we're whichever insurance company that you feel comfortable dealing with. We're the all hands people, good hands people, whatever it takes to help you understand your risk, analyze your risk, be the partner who tells you, yes, you can do it, but here are the risks associated with that. That's what we are going to try to accomplish. So right off the bat, we provide you with insurance, right? Workers' comp, liability, and property insurance. Behind that, we buy some excess insurance to make sure that we're covering those liabilities in full. And we'll talk about that more. We're also an assistance for you if you have an unemployment claim. We have a vendor that can assist you in handling your unemployment program. We can work with your HR teams, but that's a state required item that we make available. So that vendor is available to you at any point in time. There are also a couple of programs in the top third box to the right called the indemnification program. The indemnification program makes death and disability benefits available to our lights and sirens type folks across the state. So firefighters, EMTs, police. This benefit is not only critical to our state, but also our local entities. So local municipalities can be involved in this program. And we've been working really hard through Susan Setterstrom and Kim Oliver and Marcelina Scott to manage and market that program over the past year. And so claims come into that program and they get handled, and hopefully they allow us to provide benefits to employees that were killed on the job in those high hazard positions. The middle box gets into a little of the loss control. We provide you with a ton of consultation. We can provide you advice. We can make available resources. We have a learning management system vendor as one of our insurance partners that can provide you with assistance on educational topics. So all of those items can be provided to you through your loss control manager. And please, again, I'm going to say it 20 times during this presentation, make sure that you know those folks and you're reaching out and talking to them on a routine basis. To the far right, we say the same thing about loss control. We can help you with any training, education. We can do it online. We're happy to be on your site. We can help you with ergonomic assessments. So please make sure you're aware of those services and know how to utilize them. In the middle box there on that middle line, hopefully you won't have many claims, but we're realists. We understand that there are scenarios where you have claims, lawsuits, small claims, large claims. Our job is to help you understand what's going on with that claim, keep you current on the status of that claim. So we administer and adjudicate and work to resolve those claims. We, DOS Risk Management, has the ability to settle a claim, but we also have the responsibility to make sure that we're sharing with you, the state agency, information about that claim and any type of settlement, because we know that in the end, you have to live with those decisions that we make about your claims. You are the ones operationally who have to go into your community and say, yeah, you saw in the paper we had this case and it was resolved. We are aware of that. We're cognizant of that impact to you. And so we hope that we are able to make sure and keep your teams, your folks, your legal teams involved as we adjudicate cases and resolve lawsuits. And then the bottom line gets into a little bit of some of our business partners as well. Our job is to work with the Governor's Office of Planning and Budget to understand the losses and the costs associated with providing you all insurance. So we share our internal self-insurance costs and our external fixed costs for providing you excess coverage to OPB, and then we work with them to develop our insurance budget. We've had some wonderful conversations with OPB through the years, but you'll see some slides later on where we're talking about how OPB has been very forward thinking and working with DOAS to look at our risk management programs and help us determine how we can treat our trust funds and ensure that those balances are solid for the future, and make sure that we have the appropriate funding in each of those trusts so that hopefully we won't be coming to you every year asking you to allow us to raise your premiums. So there's some exciting information we'll talk about in the coming slides, but a lot of work goes into that process. You all are probably facing it now along with us with budget development time, looking forward to January of 25. So we'll talk about a little bit more of that. And then we have the fun job, along with our partners at DOAS Fiscal, to actually bill you that premium, right? And then we have to ask you to pay for it. We greatly appreciate you allowing us both to bill you and then for you to pay us. So if you ever have any questions about that billing, you can connect with risk management, and then we can connect you with our DOAS Fiscal team to help explain how you pay things on a quarterly basis, monthly basis, how we calculate those premiums, and all of that fun stuff. And I touched on the last box. So that is now who we are, a little bit of information of what we do. And I'll touch for a moment on the next slide on who we serve. We serve you first and foremost as our contact within your state agency, as our risk coordinator, right? We have a customer relationship management tool that we put in the names of the people that we work with, and we work hard to try to keep that updated, knowing that when we have a question, we have to reach out to the agency. We have a list of folks we can contact. If you're touching our property program, if you get our loss control newsletters, if you're in the LMS that's part of our program, if you're in the CRM or the IRM data platform, we should have your contact info in the CRM, and we should consider you a risk coordinator for any of the programs that we utilize. If you're on this list, you probably got this invitation because you are in that grouping. And if you're on this call and someone forwarded the meeting invite to you, please feel free to let us know that, to make sure that we can get you into our CRM so that any data that comes out about risk management comes directly to your desk. So we appreciate the relationship we have with you folks as risk coordinators, and look forward to continuing that. Also in that group, we would have to say our work comp coordinators. Kim has a massive program with a ton of contacts at both agency supervisory levels, agency leadership levels, and keeping that list current is critical for us. We have quite a few claims that wind up with people being out of work and having lost time cases. And so Kim and her team work very hard to help you and assist you at the agency level in managing those workers' comp claims. So for us, it's just as critical to make sure that we have that contact information for the work comp and HR folks who are involved in work comp in our CRM. And then the last two are pretty simple. We make available to the public those officers that we mentioned, the indemnification program. We also have a program for educators. So K through 12 teachers, we provide them a excess liability coverage. So we're fortunate to be able to have contacts within those groups and have those folks as part of the public reach out to us from time to time. We monitor the news pretty much on a daily basis. You know, unfortunately, we all hear about events that put the lives of our lights and siren partners in peril. And when those things happen, we reach out to those public officers, those school personnel, administrators, to make sure that they are aware of the programs and the services that we can bring to them. And then, you know, the last bucket better than I do, the public. You guys are providing services to the public on a daily basis. And I'm betting that on a routine basis, those people are reaching back out to you saying, hey, I have an issue, I need an answer, or I need to file a claim. So those are the people that we serve. We serve those folks through you and have resources to help you in dealing with them. So make sure you understand the folks that are in these boxes, and feel free to reach out to us as we can assist you in serving your constituents on a daily basis. So you're going to get the opportunity to stop listening to me. I'm going to thank you for your time this morning. And now I'm going to ask Ms. Kim Oliver to come on and chat with us about the workers' comp program. Kim?
Yes, good morning. Thank you, everybody, for having us today and taking the time to listen in. I just wanted to highlight a few points of what's going on in the workers' compensation program. The Appropriations Committee did fund us some additional money to undergo a second round of settlements, which we are in full swing of. We currently have about 240 additional claims that we have settled. We have another about 120 in the pipeline. So we are sitting currently at about 26 million out the door, and we have about 50 plus million to go. So if you have any claims on your desk that you would like us to consider for settlement that we might not have touched on already, please reach out to me and let me know. Just understand that if you do have an employee take a settlement with us, that they are required to resign from the state. So that is a piece that does affect some folks in not settling. So lastly, we're doing the return to work strategic plan. Gina Johnson is my business partner with Amerisys that has been helping me travel across the state. As most of you know, we started at DOC and DJJ and DBHDD as our pilot agencies. So we really do appreciate those agencies working with us. I believe that if you reach out to some of those folks, you will find out that this has actually been quite a positive experience for us. We're getting a lot of positive feedback. We're seeing a change, which is remarkable for us to be able to see, especially in those agencies where having somebody in a modified duty position is a little bit more challenging than other agencies. So we have a total of 6 return to work specialists that are geographically positioned throughout the state of Georgia. So you might have, if you're an agency that's spread out across Georgia, you might be working with a couple different return to work specialists, depending on the geographic region that they sit in. And what we're doing is just coming out and trying to do the heavy lifting for you, trying to build out your Georgia activity analyses for you based on your job titles, as that is the piece that we expect Office of Planning and Budget to audit the agencies on to see if they're in compliance with the return to work program. So we can help you on that forefront. We can come out and take pictures of your facility and pass those pictures along to the authorized treating physicians, which is really where we have found we're having the most success, is communicating and educating the doctors as to the return to work program, having them write physical restrictions that make sense to the injury versus um, return to work during the day shift or return to work with certain other environmental criteria, which is really out of their scope and they should not be focusing on. So we're actually having them focus more on the physical restrictions. What can the person actually do, and let us worry about the environment that we return them to work in. So we're working very diligently on that in an effort to try to improve the agencies that we're working with and make the most use out of our time. We're asking the GAS adjusters that are handling the lost time claims to make a referral to those return to work specialists when there is a modified duty work status that cannot be accommodated, and or out of work status. Doctor has written somebody out of work, and we're doing it on the out of work statuses in an effort to prepare for that return to work modified duty. Make sure the agency might start thinking about where they can place that individual, anticipate what some of their physical restrictions might be. And the return to work team has been a vital asset in that piece, and that their background, most of their backgrounds are vocational rehab, occupational therapy, or physical therapy. So they are aware of what the likely restrictions are going to be, and we can start working with the agencies to determine how we're going to accommodate that when we're faced with that work status. So we have been making strides in that front. If we have not reached out to your agency and you have a need, please reach out to me so I can facilitate that introduction and get boots on the ground at your actual location. And that is all I really have in a nutshell, Wade. Thank you.
Kim, is it correct that
Yes,
the fourth bullet for the GAS adjuster referrals would be not only for those first 3, but for all agencies, any claim as well?
correct. That's correct. Thank you.
Okay. Thank you, Kim. Appreciate that update.
You're welcome. Mm-hmm.
All right. I'm going to speak to, or actually, do I have a volunteer from either Susan or Jerome to talk for a moment about liability? If not, I'm happy to jump in there. Susan?
Sure, I'll jump in. Morning, everybody. So the liability program continues to rock along. We are getting a lot of new claims, and that's both a blessing and a curse. We are continuing to try to reduce our exposure and trying to do the best thing we can with these claims. Um, Best thing we can ask of you is to just tell us about them. As soon as you know about them, let us know. You can forward your claims to myself or Jerome, so we can take a look at them, get them in the system, and start investigating them to see what our exposure is. We've had some budget impacts to the program, as the bullet points on our presentation show. We're having to increase our premiums. The claims are getting costly, and we are having to increase our premiums to address that. We've also gotten some appropriations from OPB to try to resolve these claims early. So if you have claims that are on your list that you would like to see resolved, please let Jerome and I know. We have been reaching out to some of the agencies to ask them about claims that they have identified as ones they'd like to see resolved. So we are working diligently to try to resolve claims early. I think that's the big message that I'd like y'all to hear from us on the liability program. I'll tell you that we have had some agencies that are not familiar with the reporting process and the importance of letting us know when they have received a lawsuit. If any of you have questions about when we need to know about these things, to ask Jerome and I to walk you through that. One reason we can deny coverage is if we don't have notice of the lawsuit. If we don't have notice of it, we can't work on it. And that puts us behind the 8 ball. So it's important that we know about these lawsuits as soon as you know about them. As far as the indemnification program goes, that's the program that Wade had referenced earlier. That's for our public officers. It provides a death and financial benefit plan for folks who suffer in the line of duty deaths or injuries. There have been some administrative changes to that program. It used to be that any appeals for that program were heard by a commission, the Indemnification Commission, that was headed up by the governor and appointed chairs. That commission is no more. And now it's an internal process where appeals are heard by our commissioner here at DOAS. Indemnification program continues to be one that we try to promote and market. One of the big things we hear is that folks just don't know about it. So if you have police officers or firefighters at your agencies, and if they have injuries, they need to be aware of this program. And there's deadlines. If there is a death, they have 24 months to let us know about the death, or else it's barred from receiving benefits. If they have an injury from an in the line of duty accident, they can qualify for supplemental payments, and they have 60 days to put that application in. So that's a tight window. So it's important for them to know about the program so they can apply, so they don't miss it if they think that they are eligible. I think that's all I had. I didn't know if Jerome had anything he wanted to add briefly, or if Wade wanted to also chime in on some things he wanted to bring up about the liability program and the indemnification program.
I don't have anything to add. Susan, you hit the nail right on the head. So thank you.
Okay.
Thank you both, Susan, Jerome. I have just a couple of comments. Susan mentioned lawsuits being reported and filed. Please recognize that we work closely with your agencies that have in-house legal counsel. So a lot of times those cases may make their way through your agency administration and you may not be aware of it. If that's the case, we can update you on any lawsuits that you currently have that are open and pending. We can talk to you about them. We can also make sure that you have that seat in IRM so that you can go in and see those claims. But if you ever have a question and you're not sure from your in-house legal counsel standpoint, please reach out to us. If you have that relationship with your in-house legal team, if your agency has one, make sure that you continue that relationship. And anytime we can help you with it, we're happy to do so. The indemnification program, I'm going to mention for just a second. That program had been pretty calm until COVID. And when COVID came around, the statute was a little squirrely and not very clear, but we've worked with the legislative processes to kind of update it. There's still some gray areas out there, but what we're seeing is there are fewer and fewer of these types of cases that come from COVID. So now it's just getting back to the normal crazy part of being a teacher or a lights and sirens type employee and the stuff that those folks face on a daily basis. So we're seeing some of the claims volumes in that indemnification program drop, but it's a critical program. It's one that Susan and her team and a lot of folks have really helped by going out to different firefighter or police associations over the past year and a half to ask those folks to make sure that their HR teams are aware that this program is on our website. It is required by state statute. It's funded by state statute, and it's a program that they shouldn't miss. I'm going to bring up one more for a second. I apologize for not having it on the screen, but as we put it out, as we send out this presentation, I'll add it. And it is, I believe, House Bill 451 that is in effect July 1st for benefits as of January 1st. That program is going to be a PTSD, so a post-traumatic stress syndrome product that the agencies will be required to purchase. DOS is actually going to purchase the insurance product for people that fall into 11 categories. That the definition, I'll include it as well, is for first responders. But under that first responder definition, there are about 11 buckets of individuals who will be required to have this coverage. And so we're going to be working with our HRA folks and probably some of our data analyst people to attempt to pull a head count of folks that would fall into those buckets for all state agencies. It's going to be for full-time, part-time, and volunteer people who fall in that bucket that is first responder. So we're expecting that head count to be pretty large. Now, the program is going to be made up of a PTSD disability payment and like a one-time life benefit. It's kind of confusing, but we'll put that data on our website, share it with your agencies. And I say that to tell you that the cost is $155 per employee on an annual basis. So if we do the math, even if they're in our simple calculation of looking at the information from the Department of Audits, if I pull first responder numbers in the 11 buckets, there's somewhere around or more than 11,000 people that fall into that category. At $155, that's about 1.65 million in premium each year. So that program is going to be a new program that the benefit will actually be in place as of July 1, but the coverage will kick in January 1st. So in other words, if you had an individual, maybe a police officer that was involved in an event in August of 24 that created a post-traumatic stress claim, as of January 1, they would be able to file for that claim. So Department of Public Health is helping administer it. I'll put it on this slide so that you can see the actual statute, and then we'll be communicating out information about it. We'll be putting it on our DOS website so you can see that information as well, because that program will become effective January 1st, 2025. Next, we're going to talk a little bit about the property program. So I'll ask Ann Thompson if she's available and can speak to property. Otherwise, I'll dive right in there.
I'm available. Good morning. Good morning.
Hey,
everyone.
Ann, I can barely hear you, ma'am.
I'm not sure why my volume is all the way up.
Okay, thank you.
Is that better?
It's pretty light for me. How about anyone else?
Yeah, it's a little difficult to hear you, Ann.
Probably need to move a little closer to the computer if you can.
Practically sitting on top of it. I don't, I don't, the volume is all the way up. The mic is all the way up. I haven't had any other issues. I don't know. That's weird.
Okay.
That's
Yeah,
better.
we can. Yeah, a
I
little
can hear
better.
her better now.
Yeah, yell at us. Thank you, Ann.
How about this? I'll turn my camera on and then you guys can, about that. That better? Can y'all lip read?
Yeah, we can lip read too. So yeah, thank you.
All right. Well, good morning, everyone. I'm Ann Thompson. I'm the State Property Program Officer. If you have filed a property claim within the last 5 years, at some point, you probably would have corresponded with me. I'm going to jump in today and talk to you about a project we have going on with our appraisal. By now, many of you should have received our communication from Centuris Appraisals. Centuris, they're formerly known as Asset Works. They're going to appraise every state building. This project went into place, or this contract went into place July 2023. And the intention is to get every state building appraised over the next 5 years. The project initiated in January 2024. We have completed phase one. Phase one, or let me explain, the appraisals are being conducted in 5 phases by the geographical regions of the state. Phase one was our Atlanta metro areas. This was our Northwest counties. We've already completed that. That started January 2024 and ran through May 2024. We're now in phase two. Phase two is going to be our Southeast Georgia counties. Those counties are listed on this PowerPoint screen, as you can see. This phase is going to run through early 2025. Boots on the ground for phase two went into effect last month. I noticed there's several people that are on at this presentation via phone, so I'm going to read these counties off to you so that you're aware that they will be coming out to inspect your agency properties within the next 6 months. The counties that are in phase two are Appling, Atkinson, Bacon, Brantley, Bryan, Bullock, Burke, Camden, Candler, Charlton, Chatham, Clinch, Coffee, Eccles, Effingham, Emmanuel, Evans, Glenn, Jeff Davis, Jefferson, Jenkins, Lanier, Liberty, Long, McIntosh, Montgomery, Pierce, Screven, Tatnall, Toombs, Trutland, Ware, Wayne, and Willer. If your agency is in any of these counties, please expect to have appraisers on your agency's premises within the next 6 months. And if you have not received any communication from us regarding this appraisal project, please email me after this meeting so I can ensure that you have the communication. We do need a main point of contact from your agency to help initiate or facilitate when the appraisers come out. You don't have to accompany them, but you are welcome to accompany the appraisers when they come out to your facilities. Before coming to your agency locations, the Centuris appraiser is going to contact you and they're going to discuss the project scope and the time frames, the building schedule, all the buildings they have listed for your agency in those counties, accessibility to those buildings, and they'll answer any questions that you have regarding this project. Once they complete their appraisals, your agency will have an opportunity to review the property valuations and discuss that further. If your agency has any access requirements, if you're sometimes we have, like the Department of Corrections, DJJ, people, if you have require special credentials for them to access your premises, please email me those requirements so that we can ensure that the appraisers have completed whatever requirements that you have so that they can access your premises. Our goal with this project is to just reduce your annual administrative burden. While this project is underway, you'll still want to update your evaluations on BLIP. I'm going to say that again. While this project is underway, you'll still want to update your property valuations on BLIP. BLIP is open year round, so you can log on at any time and update those valuations. Hopefully y'all heard all that. If not, send me an email. I'll summarize it, but I hope I don't have any more mic issues.
Ann, thank you. Yes, you were coming through loud and clear. It was nice to see your smiling face, but we could hear you as well. So thank you.
Great.
And Ann is exactly right. We love the state of Georgia, but we do have 159 counties, right? So we kind of work with Centuris to split this process up over 5 periods. With phase one, we expect to have the review of all of that data completed here in the next couple of weeks. And what we hope to do after that is start sharing that information with you as the agencies. We want your folks to be able to look at those reports and those values We'll then share it with our folks at SPC, the State Properties Commission, to make sure that we're all in agreement with the alignment of those amounts and if there were increases or decreases before we begin the process of putting any of that data into BLIP. So, and hit the other point square on the head. Please, as we get to January, you're going to get a communication from Ann saying, hey, it's time to update BLIP. At this point in time, we're going to have you continue that process until we get through these phases. So we'll get more information to you if you're in phase 1 on what those results look like. And phase 2, as Ann pointed out, if you haven't heard from anybody at Center Risk, we've been providing them contacts now pretty routinely. Just let us know. We'll make sure that you are in the loop on what's going on with that property program. And thank you again. Loss control. I'm going to ask CG or any of his folks to jump in there and give us some commentary about the loss control program.
Well, yeah, we're still plugging along in the loss control program. All these things about claims you just heard, you know, if you can put in control programs and avoid the headache, you're ahead of the game. So anything we do to help you do that, just give us a call. Shane Burrow and Shannon just came on board. We're going to help us with that. They're both very qualified at what they do. And we're kind of changing our mode of operation from being agency based to region based. So because we're kind of spread out, so we're going to try and improve our coverage that way. If you have any needs for training, we just did some first aid classes, CPR classes yesterday. We still do the AAA. We're trying to set up another instructor course for November. We have about 100 instructors across the state. We coordinate that. Again, if we can help you with that, let us know. Online assessments are out. We're trying to get them done by next week. If you have any questions, let us know. We had some issues with that, missing segments and that kind of stuff. So shoot me an email if you need more time. We'd gladly work with you on that. We still like to get them done, but don't ignore them. And the whole idea there is to see where everybody's at and see where we can help you at and you know, get your program improved. And if you don't know who your loss control contact is, shoot me an email or give me a call, and like I say, we'll be out there to help you out and get that information to you. But anything we can do to help you report a claim makes your life easier and makes our life easier. We don't have it to deal with. If it's not there, we're ahead of the game. So thank you. Have a good day.
Thank you, CG. So here I am again with loss control. These resources that you need to make sure that you know who your expert is and what those resources are. CG is the current president of the Association of Safety, ASSP, in the state of Georgia right now. Hiram, Todd, Shane, all these folks have specialty training and can come to your facility and provide you with resources to help you manage your risk exposures. Because you're going to hear me in a few slides again say this loss control concept is critical to our ability to keep your premiums down and not see our claims liabilities grow. As we talk to our business partners at OPB, you're going to hear me say, you know, they're tired of giving me money. They're tired of me asking for money. They're asking me the question, what is your loss control story? What have you guys done to help those agencies? And so we're blessed to have the opportunity to expand that staff. You'll see on the slide under number 1, we still have 2 slots to fill, but we need to make sure and get all of those positions filled and make sure that they're in your facilities or helping you online on a routine basis to keep those claims resolved. Those dollars, if we can stop spending them, it helps you put those dollars to use somewhere else. So please reach out and make sure that you know who those people are. Make sure that you're involved or you know who is involved in number 2, that online assessment. That online assessment is also critical because we're sharing that data with OPB and we're saying, here are the results on how individual agencies are expanding, hardening, pushing forward their loss control efforts. And that is critical to our ability to help you and help you keep the premiums low. So thank you for the loss control folks. If any of you have somebody with a safety and loss control background and is looking for a job, don't hesitate. Reach out and let us know that as well. So thank you for the loss control conversation. I'm going to jump into the IT realm. I'm going to ask Dan Osmond to step in. He's here with Tim and Derek and those folks. So there's a bunch of stuff that we've talked about many times, and we'd like to talk to you about some updates and show you some current and some future stuff that's going on. So, Mr. Osmond.
Okay, thanks, Wade. You've heard us talk about Ventive for a long time. Our claim system and the tool that we use to display data to you to give you access to the data have been Ventive products. Ventive has been acquired by Risk Connect. We're still kind of looking at how that's going to work out with the two. Risk Connect is a really good tool. They're one of the ones that we looked at when we actually chose Ventive. But they're a pretty powerful tool, and it's I'm seeing some good things with them. Data. When I came to DOAS a bunch of years ago, one of the first challenges that I was given was to find a way to get data out to the agencies. We were, I think, doing a good job of managing everything inside and DOAS, but we were not telling the agencies what was going on with their claims. So took many years to do it. We finally put in place this tool called Risk Console. It has been migrated to Integrated Risk Management, or IRM. And I think many of you should know it and have access to it. If you don't have access to it, let us know, and we'll get you an account set up and get you into it. And I'm in just a minute, I'm going to do kind of a demo of some of the features of it and show you some of the new things there. Integrated risk management gives us a way to show you data related to your claims. You can log on and even drill into claims and see some of your data. We show a lot of data that's kind of overall. So I'm going to show you something in a minute that will even give you an idea of where some of the components for your premium allocation comes from, if you want to see that. So you can also, it gives you the ability to submit some claims online. Can't submit workers' comp claims through this, but liability, property, and auto claims, we'd like to see you report online. And also the CLCP online assessment tool is there. So I am going to share my screen for just a minute and show you kind of where we stand with IRM. Again, if you don't have it, if you don't have access to it, let us know. We'll get you in it. We want everybody to have access to this. When you log into it, you should land on a page that looks like this. And you have some things hidden in front of the Capitol here. It's hard to see some of that, but I'm just going to touch on what these are, and then I'm going to drill into one of them and show you a little more. From this screen, you can click this link to report a new liability, property, or auto claim. I'll click it. I'm not going to go through it and enter one, but it gives you clickable screens where you can go in and choose what you're trying to do, and it gives us enough information to set up the claim. And as soon as you hit submit at the end of this, we will have the claim in the system and we'll know about it. Adjuster will be assigned and we'll get started on it. So that link, these links give you a little bit of information about the claims that we have for you. You can run this and it shows you a list of all of your new claims from the last 90 days. You can download that list right over here. You can download it as an Excel file and get a list of all of the new claims that have been reported. You can also do the same thing with all of your open claims, currently open claims from all of the lines of insurance. And you can also see a list of closed claims. And early on, people were looking at that one. We found that there were situations where we were closing claims. Sometimes the agencies didn't know. This gives you a way to review what's been closed. I'm going to skip over these two for just a minute and come over to here. A lot of people are using the loss run report. Uh, if you you can go here and make selections and pick different kinds of data. Like I could run this and select. I say that I want to see workers' comp and open claims, or I could say I want to see workers' comp claims that happened between I'm going to say September 1st and September 7th, just to put some dates in there. You'll only see data for your agency. Most of you only have access to one agency. If your role puts you in a place where you should be able to see multiple agencies, you will be able to select those agencies here. And then once you hit finish, it's going to kick off a job and will give you a report that you can download in Excel to see those claims. So it's probably important to not run it for open, closed, and reopened claims with no dates on it. But if you want to see this list of all of your open claims, you can do that. If stop me if you have questions. Anybody, I'm kind of watching the questions here too. Let me know if you have questions about it. I'm running through it pretty fast. In the beginning, I built some objects to try to give you some detail about what's going on with claims. Built these widgets. Some of these things work, some of them don't. This is kind of our first approach at this. It's old. It needs to go away. It was developed in the Risk Console tool and migrated to IRM, and it doesn't work very well. If anybody's still using anything in here and you don't find what you need in the new tool, let me know, because otherwise we're going to make this go away. And I've marked it as deprecated here, meaning that it's not the current way of doing that. What I wanted to show you and go a little deeper in is a new way of looking at your claims. And if I've talked to you about this, you've heard me say, I want to know what I can do to help you tell your story about the data, about what's going on with your claims. This is here so that you can talk to your agency and be sure your leadership knows what's going on. So if you have questions about the data, let me know or let your program officer know. The CLCP folks can can filter information back to me. I want to know what you need, and we'll see if we can build those things into this. This new dashboard is kind of a new approach at how to do this. I'm going to go through this in a little bit more detail. There's some filters at the top. You can click a filter and select an agency. Like I said, you probably only have access to your one agency. If you're responsible for more than one, you could make the selection there. You can also break this down into different what we call claimant types. I would say start with leave these for us for the work that we're doing. Feel free to explore, but I don't know how meaningful that'll be. Just below the level of filters, there are folders. Instead of globbing all of this data for all the different insurance types together, I've broken it out by insurance type. So if you want to see your workers' comp data, it's here, liabilities here, auto, APD, property, and indemnification program. So I want to go through these a little bit, and this is changing some of I asked Wade to take a look at this and tell me if we're okay to go with it just a few days ago, and he didn't see this graph. I got feedback today. What I had in this cell didn't look very good. It was a chart that wasn't easy to read. So I made this change to it today. It's flexible. I can do a lot of things. This shows you payment trends over the last 5 years. It's regardless of whether the claims are currently open or closed. How much did we pay on behalf of your agency over the last 5 fiscal years? So I'm using a couple of agencies here in my example, but you can see what we paid on behalf of those agencies over the last 5 years. If you want an idea of how your claims affect premium allocation, you can kind of see that here too. When we're doing the premium allocation for a new fiscal year, and we're working on FY26 now, we look at the last 3 complete fiscal years to determine claim experience, or what we've paid on your behalf on those claims. So if you were to go back for your 26 data, your 26 allocation, if you looked at FY24, 23, and 22, and look at these totals, add those numbers up, that's pretty close to the experience that you're going to see when we do the allocation. So a little bit of an interesting thing there. It coming across here, I'm looking on this chart at total paid on your open claims. Now, this is for the last 5 years. This is forever. Regardless of how long the claim has been open, what have we paid on it? And you can see in this example on the open claims for these agencies, we've paid $51 million. If we were to go out to the end of those claims to where we're ready to close them, we think we would need, our best estimation is that we would need another $65 million to get those claims to closure. So the total of that is the incurred, that is what's the claim going to cost. Then over here, claims, number of claims reported by fiscal year, you can see it's kind of gone up just a little bit for those agencies. If I scroll down, and I'm going to drill through to some other data here in just a minute, but I want to just to run through them quickly. Top 5 causes of injuries for your open claims. And you can see the list over here. The total incurred for open claims, and that's again what we've paid and what we think we need to finish the claim out. And then over here is the total paid on the claims. At the bottom, I'm looking at the length of time between when the incident occurred and when we found out about it. We're looking at some of those numbers in the system right now. It's on here to look at, and we'll make a judgment of whether it's right or not. We've got some data cleanup, I think, but this shows about how long it takes us to get the claim. This one I was told is a mess, and it's probably going to get changed to look a little better. And then over here is the total number of claims we've closed for your agency in the by fiscal year for the last few fiscal years. And so you can look at the numbers that we've opened and the numbers that we've closed, and you can kind of compare where you are with that. And sorry for taking so much time, but I want to show you how you can use this. And again, I'll ask you to tell me how we can make it better. So if you notice on these, if I click on any of these cells, I select something, and that updates the entire dashboard. Everything on here updates when I click one of these. So it's dynamic. If you start drilling into something, it applies across the board. There's something here that I wanted to show you, and I'm going to pick on DOT. I don't know if Sharon or anybody from DOT is on the call. Apologize for picking on you, but this is just to show you something that I found and what I thought was an interesting thing. Excuse me. That can come from this. Looking at DOT and their auto liability claims. Most of their auto liability claims have a cause of collision or sideswipe. And you can see we've got 47 open claims. We paid over on the right side $260,000 on those claims, but we think for the life of those claims, they'll end up being maybe $2.5 million. So a lot of money, 47 claims, more than half of their claims for that type are making up about half of their incurred. But if I come through these and look at some of the others, there are 4 rear-ended claims. We haven't paid anything on those yet. There's 6 rear-ended by other vehicle. This is the one that was interesting to me and I wanted to point out. There's 7 claims where the cause was failure to yield. We've paid 99, almost $100,000 for those 7 claims. And the incurred, if we take them out for the full life, is $1.8 million. So 7 claims that we think will result in nearly $2 million. Maybe there's something that we ought to look at there. I don't know. Is there an education thing there? Is that, I don't know. I'm not making a judgment on it. I'm just looking at the data. But to show you what you can do with this, I want to drill into that. I can go to any data item on this dashboard. This, I can go anywhere on here. I'm going to go to this 7 and I'm going to right click. And you see the little target here. If I hit the target, it takes me to those 7 claims that make up that what could be $2 million. So you get more detail about them. You can find the claims. The adjuster is on there if you wanted to talk to the adjuster. You can also click the link, the claim number link, and it'll take you to the claim in the system. You can't update anything in here. You can't make any changes. You'll see some fields in here that are blank. But this gives you, if you scroll down, it's got the adjuster's name, phone number, email address, and a good bit of the information that we've got on the claim. So that's kind of where we are with that. I wanted to drill through and show you how you can play around with the data and find things where, situation where something looks a little unusual and you can drill down and see more data. That's any questions? Let me stop for a second. I don't see any new. Is there a way to view just lawsuits in IRM, or an easier way to determine which claims are lawsuits without having to pull a report that lists 7,000 claims dated back to 1975? There is currently not. I don't think we're tracking lawsuits in a way that we can put them on here. Wade, any thoughts on what we should do with that?
Yeah, we'll have to think about it. It's a great question. Thank you, Deidre. But it's not an easy answer at this point. It would require us to go into IRM and figure out what box needs to be noted to state that it's actually in litigation, and then figure out how to pull that run into the IRM tool. So that's a great one. We'll take back and see what we can put together for you. But right now, the answer is no. Dan, so also you talked about showing in one of the click-throughs, go back to one of those first screens, because it made me think if you can show the spend, the claim spend, the 3-year claim spend that we use in the calculation for a current period, I'm going to say to you, could we possibly bring in the Holman ARI auto physical inventory data as it sat at a particular year end? And then could we pull the exact blip data as it sat at a year end? Because what we hear a lot in the billing conversation is, hey, I've gotten my July 25 premium here in, July 1st, 24, and the counts aren't right. And we have to explain, yeah, you're probably right, because we had to pull the data at a earlier fiscal year period because we were building that information for the budget process, which happens earlier than the billing process. So if we could put several things on this screen: 1, their premium, and then 2, the ability to click into their resource data behind it. So they would see their vehicles at June 30th, whatever, and their blip lists. And so that keeps us, instead of having to mail out that blip detail and vehicle detail with the billing every year, we could just direct people to IRM. So those are points that you laid out here that I think could be accomplished that would help the premium Cora allocation process even better. But I thank you for this, Dan, because I think what it shows the group is there's a ton of information, there's a ton of resource within IRM that we can provide you with. You should have a seat in this tool, there's no doubt. And then we can help you in running these reports, building out your dashboard for your agency as well. And then we would say to you, don't miss the opportunity when you're in this tool and your team is in this tool to use the part that is called digital to help you report some of your cases online. And then that online assessment tool, make sure that you know how to get to it and utilize it, and make sure that you know who the people are in that process. That assessment tool has the ability for people to collaborate on it, but it also has the requirement that a fiscal officer approve it and submit it. So there's a ton of information in this IRM product that we hope you're using. And if you're not, we hope that you're reaching out and asking us, how do we use it? So Dan, anything else real quick?
And I just I didn't touch on the assessment tool. To get to the information about the assessment tool, you go to this drop down at the top left and click Comprehensive Loss Control Program, and from there you can let me back up. I'll do what I'm doing again. That takes you to here. The one big thing that you can do here is, so you would go here to submit the tool, to submit the assessment. You should wait until you get the email from us that says you've got an assessment assigned to you. Then you'll go here and there will be a place to click into it. Once you've done the assessment, you can click that second link, which I clicked too fast. And I'm going to kind of fly through this because I don't want to pick on DOT too much. But if I click DOT's assessment for fiscal 23, it brings me into the screen that shows the scores, it shows their answers, and it shows our comments about it. So that's where the tool, where you can get feedback on that from your assessment. We've also, I don't have anything to present on it right now, but we've also got the data in an aggregate report so that we can see how your agency has done year after year, and we can compare the whole state. So that's all that I've got, Wade, unless I missed something.
On this tool, the assessment tool, Dan, can you restate what you said about, the process of when we turn this on and when it's time for you to go in and complete the tool, and what happens if you do it ahead of time, that kind of scenario real quick.
Right. So we changed the way we're kicking this off this year, and it has not been the smoothest start of anything we've ever done. Last year, we kind of created tasks for everybody manually and then sent an email and said, everybody go do this. This year, we're using a campaign to kick off the assessment tool, and we'll be doing this going forward. With using the campaign instead of the way we did it last year, that improves it in several ways. One of those being, if you've done this before this year, you know that the person who is approving your agency's assessment couldn't actually see the assessment. So you were doing screenshots and dumping PDFs and taking it for the person to read before they approved it. Using the campaign function, they can go back and see everything within the tool before they approve it. If you go into complete an evaluation now, I don't even know what mine's going to look like. You're not going to see anything over here. I'm not going to see anything to evaluate because I'm not in the campaign for this. But once you get an email that says DOAS is kicking off the assessment for the year, click here to log into IRM, go in here and start your assessment. You'll see that task show up on that screen. Did that that where you wanted me to go, Wade?
Yeah, I think the critical thing is, didn't we have a scenario where somebody completed something, the campaign hadn't kicked off, and all of a sudden
Yep.
think they've submitted the report for the current year, and we're going to have bad news for that person?
Yep. Well, that was because they did it before we finished implementing the campaign. That won't happen going forward.
Okay.
Once you do this, when you go through this, you should get an email back from the system that says that you've submitted it, and here are all of the questions and your answers, and it's coming to us to be reviewed, and then you'll get feedback from us as it's being reviewed.
Okay.
But we shouldn't have any more that got hung up like that one.
And so, to Dan's point, we're calling it a campaign. That was terminology that came from Ventive Risk Connect. And that email would have been sent out to you from Inyota Reed.
Right.
Is that correct? Yeah.
That's
so
correct.
If you are hearing this for the first time and have no clue what we're talking about, you need to reach out to one of the loss control folks so they can help you get in touch with Inyota and make sure that that email was sent to you and that it is out there, or that you've started the process, because you'll see the deadline is 9/25. All right, Dan.
Okay.
Thank you.
All right. Thanks.
I'm going to go back to sharing. I hope that prompted you all to say, wow, wait a minute, I'm either getting it or not getting it, or I need to know what's going on in this arena. So we're excited about hearing from you, and I hope that if we're not hearing from you, that you've already done the steps to get you into IRM, and you're boogieing forward with reporting your claims through digital, and you're almost through with completing the assessment that is due next week. So thank you all for your time. Thank you, Dan, for running through that. Appreciate your patience, guys. It is 11:09, and we're not going to take another hour, but I'm going to hit a couple of quick points. First is, why does any of this matter to you, a person on this call as a risk management coordinator, and more importantly, me being RMS? I can help you with that. One, you've heard us talk about it. Claims mean dollars, and those dollars mean premiums. And as I calculate your premiums, it means money. And if you want another reason, it's money. And the last reason is because all this is mo money. So I want to give you a little bit of information around where all of this money gets calculated and where it comes from. And I'm going to start with this screen that is probably the best screen I've been able to put together in my 10 years. And it ties to the premiums and how we hope, in working with our partners at the governor's office and our partners at OPB, we are fortunate enough with all of the surplus dollars that are in the state system right now in the past few periods to be granted the opportunity to receive some of those appropriation dollars. That's critical because it allows us to pay down some of the old outstanding claims, and for our future have a trust fund balance that is at a level where we don't have to come out every year and increase your premium billing. So I want to highlight this. If you read the governor's budget, which we all do, I read it all the time, it tells you that RMS was appropriated some dollars during the surplus periods that we've had. So in June 30, 2022, we picked up $150 million for the work comp program and a little bit of money, $18 million for the property program. So we spent that $150 million through settlements for 22 and 23. Then again, we were fortunate even more so in 24 when the governor's office said, look, you guys did a decent job. Kim did a wonderful job of settling cases for the work comp program. We have additional funds. We're going to entrust you to spend it, and we're going to give you some money for each of your programs. So if you'll see, you got money for the workers' comp program, another $125 million. We picked up $75 million for the general liability program to help settle cases and shore up the trust fund balance that sits in that program. And then the property program, I'm going to speak to in a moment about our premium billing history. We picked up $50 million. So we were blessed to no end in June of 24 to get 250 million within those trust funds. And then today, I mentioned earlier that our partners at OPB are really doing some forward thinking. They're again saying, there is a potential that there might be some surplus money at June 30, 25. And so we've sat down with our commissioner and our fiscal partners at DOAS and laid out the story that fortunately the work comp program is looking better, but our general liability program, our liability that sits out there that's a future liability, continues to grow, and we probably could use some more money. And then the property program, we've said, the property program is the most volatile only because of Mother Nature. Ann does a wonderful job of handling claims and fighting with Mother Nature, but if she rears her head, there could be a claim that really demolishes the property trust fund. So you'll notice in June 30, 25, there's some conversation that hasn't been concluded, and I'm sleeping at night with my fingers crossed that there might be additional dollars coming into our program for June 30, 25. So if you do that math, if you add up 168 and 250 and whatever the number is for 25, you'll see that we have been extremely fortunate to get over $400 million into this program, something that hasn't happened in my 10-year career, probably won't happen again. But it leads me to the next slide. What does all of that mean? It means that it helps us bring you the insurance coverages that we provide. And this slide shows you that there are really two components to our insurance program. We have a self-insured program, and then we buy what's called commercial excess coverage. So you guys are familiar with these lines. Workers' comp is, it pays for medical and lost wages for our injured employees. We have a liability program that provides coverage for three different arenas. State tort, that has to do with negligence cases. Those cases are limited by the State Tort Claims Act. There are general liability claims. Those are federal cases where there's no cap provided by a state statute. Those are the big ones where the hairy stuff comes out and we purchase excess coverage for. But those are federal cases, employment cases. We actually have another program for the state authorities that provides some contractual liability. So those are liability programs that apply to your organization. And then you all know we have property programs. We've got the state-owned building and personal property agreement that covers your buildings and your contents. We cover your inland marine, fine art, other items through the special property all risk agreement. And then you have the choice. You can decide as an agency if you want to insure the physical damage for your autos. Your auto liability falls under the liability program, but your physical damage falls under the property program. And then we provide cyber insurance. So I'm going to talk to you in a minute about what those premiums look like, but those are the pieces that I call DOS self-insurance. Below that on the screen, you'll see that there are several coverages that we go to the commercial market to purchase, and those act as excess coverage above the DOS programs. Workers' comp, we cover the first 5 million of every claim, but we buy coverage from a carrier that sits atop that program. That covers over $8 billion of insured payroll. So there are premium numbers associated with these as well. Excess liability, those set above the federal program. We have 4 carriers that make available coverage in the event that one of those cases goes really south and the settlement or the jury verdict is more than we were expecting. Property, we have 52 billion in insured value and about 13 billion in business interruption. And because of that, we buy excess coverage. We have a shared and layered program where about 65 domestic and international carriers provide us coverage for the property program. Cyber insurance, we have the executive branch agencies that are covered under one program. The university system has their own tower, which is not inside our program, but our cyber program is provided by 4 or 5 carriers as well. And then we have marine, crime, terrorism, boiler and machinery, and aviation coverage, along with excess aviation coverage. Some of those are liability coverages. Some of them are for the personal property itself. But you'll see we cover close to 100 marine craft, over 100 aircraft. We've got a ton of UAVs. All of those things are insured through the excess coverage. And then finally, there are a couple of products. One is, I mentioned earlier, is the Excess Educators Program. That is statutorily required. We pay for that program. And then the last one is the SPAR coverage. Above SPAR, we have what is called inland marine coverage. And we're insuring about $335 million worth of value that fall into those SPAR buckets. So I want you to understand that. And you can see on our insurance section of the DOAS Risk Management website information about these programs. So we'll talk about that in a minute. But there's money associated with both of these pieces. We call this top level our fixed cost, right? It's the premiums associated with this program. And then we have the additional fixed cost, that is the excess coverage. I tell you all of that to show you this. For all of those excess insurance pieces I just went over, these are the premiums we've paid back to FY19. Georgia Tech has a defense-based act coverage that's a little bit different because of some of the federally required work they're doing. So I include it here. They also have a really large out-of-state workers' comp exposure. There are probably more of you who have this, but Georgia Tech has a really big one. And so I list out for you all those premiums: excess, cyber, property. And look at these numbers. From 19, it went from 20 up to 25. So I want you to focus on the bottom number, 22% increase. In 21, we had a 22% increase over 20. 22 was pretty calm for some reason. Or that was a pretty calm year. But look at 23. 23, the property market started acting crazy because of all of the international cases that we've been having, all the big fires and hurricanes. And you'll see a huge jump. And look what happened from 23 to 24, an even larger jump. This property line is going to tie into some of the reasons we explained as to why we increased the insurance billing for DOAS. But I want you to have this history. That excess insurance has continued to grow. But look what happened in 25. In 25, we took the 24 number and we were able somehow through the property market changes to see a slight reduction for our overall program, a 3% reduction. It's not monstrous, but it was better than keeping pace with 30% increases over the past few years. So these numbers were used to factor into the premiums that we charge you. So when I look at the math to determine the premiums, we have to look at not only the fixed costs that are premiums, but also what the future cases may cost us for each of these programs. So I want to show you this. This is an actuarial presentation that says when we looked at all the open cases at June 30th, 23 for work comp and the liability programs, here's what we thought you were going to wind up spending: $1.2 billion. Well, we were able to take a lot of that appropriation money and work on the work comp line. We settled a bunch of cases. We closed out a lot of old liabilities. And you'll notice at 24, when the report was completed, which was just recently, we saw a huge impact. That is the kind of news we need to have going forward. So the work comp program is beginning to stabilize. But look at our liability program and how this is going to impact our trust fund. That liability program went up 33 million for the federal cases, and it went down a little bit for tort cases. But that growth is, pretty substantial when it comes to thinking about what the future cost of the program and the future impact to the trust fund balance is going to be. So we take the fixed cost, we look at the future liability for these outstanding cases, and we develop the premiums to charge you. This screen takes those fixed costs and those future liabilities and those historical claim payments, and it melds them together to help us craft the request that goes to OPB every year saying, here's the premium we want to charge the state to cover the expenses of running this program. So you'll notice work comp has been extremely level. And the future strategy would be, is that trust fund solid enough that maybe the premium starts to go down. So we'll start having those conversations. You'll notice in liability, it was consistent for several years, but the liability was really just being kicked down the road because we didn't have state appropriations to settle cases. So we increased that premium last year to 60 million. So we're hoping that these recent appropriations will help us stabilize this spend and manage it for the future years without having to increase premiums. And then property is the one that made some people see red, including Wade. This program, we were billing way below the market for many years. In 24, with all of the increases we saw in the excess market, we went to OPB and had to beg and plead and say, look, the trust fund is depleting rapidly. Unfortunately, we're going to recommend a huge increase in property. And that was approved. Now, it is helping right size the trust fund, but it had some pretty major impacts on some of our larger organizations. You can imagine USG, they have a ton of building value. And so that increase was critical to their operation. But we've gotten through it. We've survived it. Excuse me. And what we're hoping is that that will stabilize and we will not see a 343% increase in the property premium anytime soon. Business interruptions, SPAR and APD have been pretty consistent. APD is growing. That number shows consistently here, but the upcoming premium for APD due to a couple of the large agencies is going to really change. But overall, it's been pretty steady. So I'll point these components out to you so that you'll have a better understanding of what it takes to pull together the cost and the expense associated with providing you insurance at the DOAS level and the excess insurance level. Again, I'll provide this presentation to you. You'll be able to look at these numbers, ask us any questions that you might have. And we're approaching 11:25. So I'm going to say the last comments here with this last slide. You heard me say it earlier, but why does it matter to you and your organization? It matters because we want you to tell us what you need. You know, we're making presentations, we're coming out, we're helping you, but what do you need? Is there something we're missing? Is there a particular goal your organization is trying to accomplish? Are we impeding that? Or are we helping you? So let us know what you want to discuss. Let us know what resources you need that we can make available to you. We have tons of them on our website. Are you using them? Are they the right ones? And provide us your feedback. I love to hear when our folks are doing great. I love to hear when there are areas that we should be focusing on to assist you with. We'll take it all. And then more importantly, let us come to you. Let us meet you on site. Let us meet you virtually. Our to you. And then I'm going to stop sharing for 2 seconds and reshare just to give you an opportunity to say, I hope you've seen this tool. And it would be the DOAS website. We have an amazing IT team, communications team, education team that's rebuilt this website in the recent year. Come over to divisions and click on risk management. Please make sure that you're checking this out. Going through our website gives you a lot of the information that we've shared with you today, gives you more resources. You can click into any of these programs. You can search by sections within our division, but click on all of this information and dive into it and let us know what we're doing to help you manage your risk management program. And if there's something that we're not doing, please raise your hand, shout at us, let us know, call us. If we need to come out and do a town hall for just your organization on a regional basis, whatever, we're open to it. We would love to do it. We believe that risk management is critical to your organization and the success of your organization. And we want to be involved in it any way that we possibly can. So with that being said, thank you for questions that you've thrown in the comments. We'll make sure that those are all answered. We'll send you this presentation and we'll look to you for your feedback, your emails to tell us how we can assist you, what we missed, and look forward to the next time. We're going to try to continue to do these either twice a year or quarterly. But we appreciate the opportunity for you all to join us and provide your input. So that being said, I'm going to give you back a little bit of your time and say thank you, and have a great weekend.
Thank you.
Yes, thank you, everyone.
Thank you.
Thank you.
Great job.
Thank you.
Wade, I noticed somebody
Have a
has
good
their
one,
hand up.
everybody.
I don't.
All right.
Yeah.
Anybody? Yeah, I didn't see a hand up. I saw some thumbs up. I don't see
Yeah,
hands.
it was April Wall. She had her hand up.
April. All
She
right.
did. Maybe she'll reach out to you
Okay.
because it looked like she had her hand up and then dropped.
Okay. Well,
I'll
please.
I'll give her a
feel
call. I got
free.
something else I got to talk to her about anyway. So
Thanks,
all right, plan
CG.
to give her a call.
Thank you all.